Hi, my name is Ranjini Ramnath and I'd like to discuss my behavior change project. My behavior change project was conducted with Bashu, a 14-year-old girl diagnosed with microcephaly. Her condition was identified at birth. She has been at my center since the age of 3. According to the psychological assessment done in June 2014, Bashu's diagnosis included intellectual disability with moderate developmental deficit and severe mental retardation. Very recently, she has started dressing independently, though this is not yet a generalized task. She has difficulty in eye-hand coordination and takes time to button her shirt. She is compliant during the dressing training at the center, but resists her mother's instructions to dress at home, especially early in the morning when she has to come to school. Parental priority dictated the choice of behavior to be changed, as they were concerned with Bashu's lack of independence in dressing given her age. Independent dressing is defined as taking out undergarments and uniform from the wardrobe and wearing all items of clothing which include panty, trainer bra, slip, shirt and pinafore, resulting in Bashu being fully dressed in her uniform before going to school in the morning. Non-examples would include opening of the wardrobe at any other time during the day or wearing any other garment other than the school uniform. The projected and desired duration of the activity was 10 minutes. Independent dressing was measured by the number of garments worn independently, latency, and the time taken to complete the task. Alternating treatment design was used for the project to include 2 interventions. The intervention was divided into 3 parts. The first part was training at the center to improve fluency in the task. The second part was management of antecedent strategies to alter Bashu's motivation by advancing bedtime the previous night, and thirdly, training on the dressing activity in the natural setting, which was the home. This included 5 days of baseline collection, 4 days of the first intervention, which included early bedtime and a visual schedule, and 3 days of the second intervention, which included early bedtime and video modeling. A preference assessment was conducted before the commencement of the intervention. A video was taken of the visual pictorial sequence of the dressing activity, followed by a video of Bashu taking out clothes from the wardrobe and a video of Bashu being fully dressed. During the intervention phase, Bashu was shown this video and given training in dressing at the center. For the second part of the intervention, the parents were advised to send Bashu to bed early, which is by 8 p.m. the previous night, so that she'd have 9 hours of sleep before waking up at 5 a.m. the next morning. For the intervention in the natural setting, for the first 4 days, the mother was instructed to use only the visual cards pasted on the wall to prompt Bashu to dress up. On the last 3 days, the mother was asked to include the video before giving Bashu the instruction to get ready. A prompt hierarchy was given to the parents. Once the instruction was given, the mother would wait for 10 seconds for Bashu to comply before prompting. Bashu was provided verbal praise and a token for a successful completion of each step. Based on the number of tokens, she was given her preferred trinket in ascending order of her preference by the teacher at the center. This is the intervention recording data sheet maintained by the mother. The duration of the treatment was short. Treatment fidelity data were collected by the teacher and the parent for 100% of the intervention. There was a downward trend in latency and time taken to wear the uniform, and an upward trend in the number of garments worn independently. The trend was consistent through the 2 interventions. The IOA for baseline was 86.66% and for the intervention period was 90.47%. The change in the sleep pattern, along with the steady plan for intervention on 2 fronts, the center and at home, seems to have made a difference to Bashu's motivation to dress independently. The video modeling worked better than the visual sequence. Time was a limitation in this project. The latency for the intervention period could not be measured due to procedural flaws in the intervention plan. As the latency was interrupted after 10 seconds after the instruction was given. The procedure should be changed if a similar intervention were to be developed in future. The treatment was home based and heavily reliant on the parent being able to conduct the intervention with integrity. It was not clear how this could be changed because the natural setting is a critical component of this project. There was not enough time available for to factor in generalization and maintenance of the uniform wearing skill. Independence in daily living or adaptive skills ensures increased successes in employment, independent living, and ease in social situations. Parents are significant members working with their adolescent children, and there should be more studies and research conducted on training parents of adolescents. Thank you.